Now, something that comes up a lot with the babies are blocked tear ducts. Just briefly, can you mention what a blocked tear duct is, what parents should do should their child have a blocked tear duct, and when should they come to see you?
So blocked tear ducts are pretty common. The tear duct system is where your tears drain from your eyes down into your nose. And it actually goes, the only part that you can really see is a little opening in the upper lid and lower lid, and it's pinpoint. And then it dives deep and into the bone and behind the nasal passage. So the tear duct isn't something you can really see. As it's developing, it has little saccules to it that have to open up itself and become patent and become a complete passageway. And so 90% of the kids, before they're one, it's not completely open. And those are the kids that get a blocked tear duct. By the time they're one, 90% of them will spontaneously open. And so it's very common. It creates a watery eye. Some kids can get some discharge with it, especially in the morning. And so for the most part, you just got to give it time. Some people talk about doing massage, and I think massage is a good thing. The studies don't show 100% that it works, and it's because a lot of kids get better on their own. So is it the massage, or is it just time that makes it better? I have a sister. I told you my sister is an ophthalmologist, and when I was earlier in my experience, I said, I don't have the parents massage. The studies didn't really show it. And she said, as a parent who had a kid who had a blocked tear duct, and I massaged the right way, she's like, I know exactly when to open. And she's like, I think you're doing the parents a disservice by not telling them to massage.
Interesting.
And so I think it's more the technique of massage. So everybody massages different. But the true technique is, I compare it to actually plunging a toilet, which may sound wrong or right. So what you're doing is you're going to put your finger in the inner corner where the openings are in the upper lower lid. You're going to push in and down, and you're going to use that fluid in the tear duct system to push on that membrane. So it's not a round circular movement. It's not rubbing the nose. It's closing the openings and pushing in and down. And you're trying to put pressure on that membrane down in the nose. And so that's where you can get it to be better. Too many people to kind of do circular motion or rubbing in the nose and different places, and you're not gonna touch anything by doing that.
And then if the 90% of kids that don't, so 90% clear up by a year, the 10% that don't clear up by a year, is that when they should come to see you?
Yeah, if they're over a year, I have them come in to see me. And then the process is that they have to be opened up under general anesthesia. So it's a process. It's not something you can do in the office. There are pediatric ophthalmologists who do it in the office. They do it when they're very young, when they can be restrained and held down. And so, but you're doing it in kids who it will likely get better anyway. So, there's a camp that says that's too excessive. You don't need to do it in those kids. It's also a very fine duct system. And so any injury you make, you can scar it closed and then make it not work in the long term. So for me, it's safest to go under a very short anesthesia. It's 10, 15 minutes. And then they're asleep. They don't move. I open it up. I make sure the fluid flows through it. And then they get to go home the same day and activity back to normal.
And what's the harm should a parent opt not to do the procedure?
Some kids get a lot of discharge. So they get these kind of chronic bacteria that sit in that pool of tears down in their nose. And so they get a lot of discharge. They get some skin breakdown. They get sores. As far as vision development, the studies actually have not shown that a blocked tear duct changes or affects vision development. So for the most part, if it's mild or it only happens when they're sick or they're congested, it's perfectly fine to leave it and not have to have surgery. But those kids who it's chronic, it's watery all the time, it bothers them, they get red eyes, they get discharged. Those are the kids who all go in there and open up their tear duct system.
I've read the 90-10 rule that 90% clear up by a year. And if they don't clear up by a year, only 10% will clear up beyond that point. Does that ring
That's
true
very
to you?
true. That's very true. So I tell my parents when they come in and they're 12 months old, and then we schedule it for 2 months out. I said, this 2 months may be your blessing, because sometimes there's nothing magic about the 1 year mark. Sometimes it can go away in those couple of months too. And if it does, we just cancel the surgery.
I actually have a patient who's coming to see you, who's scheduled to see you this week for a tear block. Sorry. Do you call it deck restenosis or?
A lacrimal duct obstruction or a blocked tear duct.
So I have a patient who's scheduled to see you this week for a blocked tear duct. And she said, I don't know, but I think it cleared up this week. And I feel really guilty because should I cancel the procedure because I actually think it's cleared. And I said, Dr. Sebring's so nice. I'm sure she'll be very understanding.
Absolutely. And I always tell my parents, I said, the whole point of everything I do is for the kids. And there's no reason to put the kid under anesthesia if the kid is healthy and doing well. And then if it gets worse later and the mom says, well, you know what, maybe it's still there and now it's gotten worse, we can always do it later.
And the feedback that I get from parents that are nervous before the anesthesia, just so you know, or just to tell people listening that if they ever do need to have a blocked tear duct surgery, they report very favorably that it's quick, that you're quick, that the anesthesia procedure is very fast, and they're pleased that they're in and out. I've heard 20 minutes.
Yeah.
That's the rumor on the street.
Yeah. And sometimes, depending on the anesthesiologist, sometimes it's just a laughing gas inhalational anesthetic. And so they're really not fully intubated. I just need a baby who's asleep and that's not going to move so I can get my procedure done and get it done precisely and make sure it's a fit, make sure I get everything addressed.
That makes a lot of sense to me.